let's talk about something else that needs some clarity as well, because there's been some confusion about the promise for 50,000 new nurses.
More
extra nurses. More nurses
Very
across.
Important distinction.
Absolutely, across this government. You're saying the NHS from 280,000 will go up to 330,000 pounds. Those 50,000 nurses. Those 50,000 nurses. Yeah. Those 50,000
nurses. Yeah.
I'll get there in the end. Those 50,000 more nurses, Matt.
You have to forgive us for being slightly confused, Matt, because we spoke to Nicky Morgan this week on the programme, who admitted that 50,000 more nurses would include 19,000 who already exist in the NHS, which by anyone's calculation means there are only going to be 31,000 more nurses.
No, 31,000 new nurses, 50,000 more nurses in total, because some nurses do leave the NHS, and I want to reduce the amount of nurses who leave the NHS and go and work elsewhere. I want the NHS to be an even better place to work, and by reducing the number who leave, you increase the number who are there. By definition. So 50,000 more nurses. I understand that Piers got a bit muddled, and it's a shame that he's
not just Piers. That's not fair. It's not just Piers. It's not just Piers. But Matt, if those nurses are already working in the NHS, they're already there, and you're just choosing to make sure that they stay there, how can you describe them as more nurses? They're already there.
You're double counting them.
Yeah, because the commitment is to increase the total number of nurses who are currently working in the NHS from 280,000 to 330,000. That's a 50,000 increase. And of course, if you run any organisation, to increase the number of people you've got, you want to hold on to more of those you've got already, and you want to get new. And that's what we're going to do. So,
why don't you just go the whole hog and say we currently have 280,000 nurses, we're going to have 280,000 more because we're going to persuade every single one of them to stay?
Well, at the moment, about 27,000 leave each year, and we want to reduce that figure. Because working in the NHS is an amazing thing to do, but I want to make sure that it's even better working in the NHS.
With all due respect to you in your position, can you not see how the numbers don't make sense to people? If you are hanging on to a member of staff, that person is already counted in the figures. You don't add that person to the figures because you persuade them not to stay. I mean, not to leave.
But if they were to... No, but if they were to leave and then you improve the working conditions so they don't, then you end up with more people at the end.
But
the point is this:
you keep them, you don't gain them. You keep them.
Let me come back to the. Let me come back to the central point, okay? Which is about what is our commitment to the NHS? What is our commitment to making sure that the NHS is always there and stronger by the end of the next Parliament? The commitment is that by the end of the Parliament, there will be 50,000 more nurses in the NHS than there are today. I know, and so that's the commitment to hold us to. We then set out the plans for how we plan to get there. But the key is on this. I'm really straightforward about what we're promising. We are committing to, we have the funding for, we have the long-term plan to deliver more nurses in the NHS, 50,000 of them, in the totality of how many nurses there are. And that's the clarity that I think people are looking for.
The problem is people are watching and they're going to consider what you're saying. We're just trying to hold you to account to what you are saying. You're massaging the figures so it sounds exciting. Massaging the figures. Everyone's going to be sitting at home saying, how can you retain a nurse and then count her or him as another nurse? You just can't do it. That just is not how it works.
So the reason... I understand that. And the reason I'm so emphatic about this is that it really matters to me that, and the words we've used are very, very clearly chosen. We have not said 50,000 new nurses coming in from outside. We've said there will be 50,000 more nurses than there are today. And, you know, if you're in a bed on a hospital ward, and what you want to know is there are enough nurses, and there are more nurses on the ward. It matters less to you whether somebody's, you know, a new recruit over the next 5 years, or somebody who previously, without any changes of policy, might have retired early or left and gone and done something else. And instead, because of the effort that we're going to go to, because of all the work that we're going to put in, and because of the policies that we've got, for instance, on better childcare, that person has decided to stay. In fact, one of the best ways to increase the number of nurses in the NHS is to ensure that the nurses who are currently there don't leave, and because then you do end up with more nurses. So I'm really clear that it's more nurses, not new nurses. They are already counted in the numbers. And what people don't understand is, why didn't you just say we're going to recruit 30,000 new nurses? Why did you have to get yourself in this muddle by double counting nurses who you're just going to persuade to stay? Because it is absolutely, we've been really straightforward about it. The way that we have made this commitment is on the basis that there are currently 280,000 nurses and there are going to be 330,000. And what matters when you're running a large organisation is how many people do you have to do the job. And that is the way that we've framed the commitment. Because, you know, that's what matters by the side of the bed. You know, yesterday I was in a hospital in Cornwall. What matters in that hospital is that they have more nurses. Yes, and that's what they're going to get. I know, and we heard some of those nurses challenge Boris Johnson, asking, where are you going to go get those more nurses from the magic nurse tree? Absolutely. And we've got a plan for that. But we've got a plan. We're going to have more apprenticeships, for instance. We've got more apprenticeships in nursing. I think that apprenticeships are brilliant. We're going to hire more nurses from overseas. I don't know if you saw overnight, there's figures showing that we've got an increase in numbers of nurses coming from overseas. That's a good thing. Yeah. We're also going to have more university training for nurses. So absolutely, and we're going to do more so that nurses who have already got a qualification and then taken time out maybe to raise a family will come back to the NHS. Well, we've got a plan to deliver and a commitment of what we're going to deliver, because we love the NHS. We do. We all love the NHS. We're going to have to leave it there. Unfortunately, Matt, we have doubled our time with you. The Health Secretary, we're going to have to leave you there. Matt Hancock. Thank you for joining us this morning and coming on finally, though. It's good to speak to you. And bye-bye. Okay.